What about alternatives that are out there the patient should consider before having their joint replaced? Obviously, there are some situations where there is no alternative, and it's fairly obvious that there isn't. But in general, what is out there besides replacement?
Yeah, so I mean, initially when someone has pain from arthritis, we always try to avoid any kind of surgery. I tell every patient there's nothing better than their knee or their hip if they can keep their own parts and not hurt. So if we can avoid surgery and keep their joint painless and they can swim and golf and play tennis, the typical things we do are over-the-counter anti-inflammatories.
Which would be like an Aleve or an ibuprofen?
Ibuprofen or Aleve. There's prescription anti-inflammatories that are designed to be a little bit safer on your stomach, and you can tolerate them easier because they're once a day. And
is that the biggest problem with taking anti-inflammatories for most people, is a stomach issue?
Anti-inflammatories can cause two things. They can cause GI upset and bleeding, and they're excreted from your kidneys, so they can cause kidney failure. So those are the two big risks of taking excessive amounts of anti-inflammatories.
So you put off surgery as long as possible. At what point do you come to the conclusion that a surgery is necessary?
So yeah, I mean, if someone's done the anti-inflammatories, the other real popular thing we do are injections of the joint. So we can put an anti-inflammatory medication into the knee or the hip or the shoulder, whatever joint's arthritic, and there's a variety of injections that we have a choice of today, from typical anti-inflammatories, which are just like Motrin or Aleve that we put in the joint. There's visco supplements, which are lubricating injections specifically for knee these days. That can be helpful. And there's alternative shots. People hear about platelets that are getting
Is that platelet-rich therapy?
PRP is called platelet-rich plasma, where people get their own blood taken. They extract the platelets and inject those platelets into that specific joint.
Do you do that?
And platelets are anti-inflammatory cells. Right now, there's no real solid data that proves that PRP really works for arthritis. Or the other alternative is stem cells are very popular with patients. They always ask me, why don't I get the stem cells? Because their favorite athlete got them.
Right.
Because they heard about him flying to Germany and got, if you have extensive resources and you could, light $20,000 on fire in your driveway, you can do all those alternative shots, but none of those kind of alternative things are approved by insurances, which typically mean they don't work very well.
And how long can you expect some of these injections to last in terms of pain relief?
And I've had patients that do typical simple injections or the visco supplements for knees, where they can do 2 or 3 injections a year, and they've been doing them for 10 years. And people do 1 or 2 injections and they feel great. If you can keep your own parts and not hurt and do everything you like, then that's by far, no one's gonna give you a better knee than your own knee that doesn't hurt.
How about, what's the pain factor, excuse me, on those shots?
Injections are a little bit painful, just like any injections, but they're pretty simple. People usually are surprised on how easy they are, as opposed to how much they hurt.